Let's bring in President, National Association of Resident Doctors, Dr. Mohammed Suleiman, for more on this development we're tracking. Dr. Suleiman, thank you for joining us on the news tonight. Your association, we understand...
Thank you for having me. Good evening.
You're welcome. Your association suspended its last industrial action on the strength of agreements reached, I believe, with the federal government. As we speak today, what specific commitments have not been implemented, and at what point did you conclude that government had failed to act in good faith?
Thank you very much. When you look at the issue of our unjustly terminated members from FTH Lokoja, I can show you their termination letters, all 5 of them. The National Assembly, through its Committee on Healthcare, Tertiary Health Institutions, made a pronouncement and directed that these people be reinstated back to Lokoja. The Federal Ministry of Health itself set up a committee comprising of the board chairman, a member from the Department of Human Resource Management in the Ministry of Health, and a professor of law who looked at all these issues and still recommended at the end of the day the reinstatement of these our colleagues back to Lokoja, even recommending the payment of their salaries and allowances for the period that they were taken away from work. And we signed in the MOU that these recommendations will be implemented fully within 2 weeks. Only for us to receive a letter last week from the Federal Ministry of Health telling us that we should advise our members to pick up employment in other hospitals. This is actually unacceptable. With respect to the professional allowance table, this is an injustice that started from 2019. And eventually, when we agitated last year and went on strike, the federal government eventually released a correction of the professional allowances. It's a correction. It's not a salary increment. Now, they didn't give us the 7-year arrears. They gave us 18 months arrears. And they assured us that this January, 1/1/2026, these allowances will be implemented. As I'm talking to you, there's no provision in the 2026 budget capturing this in personnel expenditure. What they are telling us now, in fact, after the NEC has resolved to even resume the strike action, is that the budget office has captured something in a service-wide vote. Remember that the 2025 budget itself had a lot of the service-wide votes suspended. Remember that our 25-35% arrears and our countrymen arrears were said to be captured in the service-wide vote of last year's budget. And they were not paid until towards the end of the year, after we agitated. So we can't come back to 2026 and still be doing the same thing with respect to the professional allowance table.
Let's talk about
the entry level for doctors.
Dr. Sama, let's talk about this budgetary allocation for a minute. You've now fixed midnight on January 12th for a nationwide shutdown. Some of your demands, especially allowance arrears and budget capture, in reality we require some form of bureaucratic and budgetary processes. What realistically can government do within days to avert this strike?
Realistically, the circular captured that these arrears of the 18 months of the professional allowances will be captured in the 2026 budget. Is there written in the circular? I mean, we didn't hold the hands of government to write that circular. That circular was written by Ministry of Health and Salaries and Wages Commission and released just the way the law of Nigeria provides for. So from the day it was released, which is sometimes in November, everyone knew that the budgeting process needed to kickstart. We even mentioned it. We agreed on it that this implementation was going to take place. We did, only for us to now come 2-3 weeks later, and we started running ourselves to the budget office to try and follow up on these issues, to only realize that we're even talking about capturing it in service-wide vote to repeat the same problem that we fell in with other areas, other allowances, other salary issues in 2025. We want to transmit the same into 2026.
I hear you, Dr. Suleiman, and I hear the grievances. We've been reporting it for hours now. But critics argue that repeated strikes, in a way, deepen public suffering. And in addition to that, it also weakens confidence in public hospitals. We're hearing about center-based protests, regional demonstrations, a national shutdown that you are planning. What assurances can you give tonight to Nigerians, especially emergency and vulnerable patients, that they will not be abandoned?
It is important that public confidence in our hospitals and in our healthcare service delivery remain high. It is also equally important that the national disaster that we are all heading to, the national emergency that we're currently in, be averted. What do I mean by this? In 2024 alone, 4,700 doctors, not healthcare workers, doctors left Nigeria. By the end of January, this month or next month, we'll get the statistics, how many left Nigeria in 2025. I can extend this number by telling you in 2014, there were 25,000 resident doctors in this country. As of today, we have less than 11,000. And these figures cannot be disputed upon. Now, I can juxtapose this with figures from the Federal Ministry of Health that shows that maybe in the second or first quarter of last year, perhaps we had 10 million visits to primary healthcare facilities. In the latter quarters of last year, we had over 40 million visits to hospitals. It is these same healthcare workers that are depleted in number, that are under-remunerated, that are underappreciated, that will still see these patients. I can tell you there's a Dr. Halima in a hospital in Gombe that is the only person on call, is the only registrar on call from 1st January to 31st January. I can tell you physicians give out 106 hours averagely every week. So
I hear you, Dr. Suleiman. What I'm trying to say,
let me land on
let me just butt in for a minute, Dr. Suleiman. I hear you clearly. If you can just hold on for a minute, Dr. Suleiman. What I'm trying to say is that going on strike is adding salt to injury. It's going to escalate all of the things you have listed. You don't think so?
Or going on strike is to call the attention of the government to respect agreements that they have entered into to ensure that we retain our trained workforce here in Nigeria. I mean, in a year, we produce 2,000 to 3,000 doctors in Nigeria from all our universities. In a year, we lose almost 5,000 of those doctors. It means we are losing more than we are producing. And what are the reasons? Excess workload, poor remuneration, underappreciation, burnout. We're talking about these issues now. Assuming we continue working, and then 4,000 again leave in 2026. By next year, another 4,000 leave, and we keep producing 2,000. So every year, we're losing effectively 2,000 to 3,000 doctors. In the next 10 years, where will the current 11,000 doctors be?
All right. Dr.
So
Suleiman.
we're heading into a ditch. We have seen the ditch. We know the ditch is ahead of us. We have our eyes functional. We can walk with our legs, but we are still heading for that.
Dr. Suleiman,
now they're saying enough is enough.
You have now said clearly that no implementation, no going back, right? For clarity, what is the single verifiable action that you think government can do now that will lead your association to suspend the strike, even temporarily? If you can answer that in 30 seconds.
It's disheartening that we had 19 items on our demand list. Now we have compressed it to 15 or 16, but I'm hearing Federal Ministry of Health saying that it is 9. That means they handled 10. They have not handled 10. They have touched on some, they have touched on a few, they have completed maybe 1 or 2, but we still have 16 issues to handle. How do I choose between reinstating people back to Lokoja and payment of professional allowances? How do I choose between that?
All right.
It is important that the government lives up to responsibilities and agreements it entered freely, willingly into.
President, National Association of Resident Doctors, Dr. Mohammed Suleiman. It's too early in the year for a strike. Hopefully, government can meet you guys somewhere in the middle. Thank you so much for talking to us.